You are listening to From Embers, a weekly show on CFRC 101.9 FM about anarchist and anti-authoritarian ideas and practice. We are broadcasting from the traditional territory of the Anishinaabe and Haudenosaunee peoples on land that has come to be called Kingston, Ontario, Canada, because of the thievery and brutality of the Canadian state and its empire-loving parents. From Embers is about fires, some real and some metaphorical. Fires started generations ago and tended to over the years. Little sparks all across this territory that we hope will grow, spread, and engulf the thieving state called Canada and the capitalist system that has plagued this land since the fur trade.
Today on From Members, we're speaking with two people about criminalization in the context of the COVID-19 pandemic. Alexander McClelland is an AIDS activist based in Ottawa who is tracking police responses to the pandemic and resistance to the rising authoritarianism associated with it. Zoe Dodd is a harm reduction worker in Toronto who's addressing the COVID and overdose crisis. Together, they worked on a project called An Anarchist Response to Hep C and Hiv for the Institute for Anarchist Theory. I got their take on the Canadian healthcare system, the problem with government approaches to quote-unquote public health, some history about Hep C and Hiv criminalization, and what it can tell us about what's happening with COVID right now.
My name's Alex McClelland, and I am an AIDS activist, I'm also doing my postdoc at the University of Ottawa in the Department of Criminology. I have done a bunch of research on the criminalization of HIV in Canada with like a long-term goal for abolition of all forms of criminalization. Right now, I'm kind of been working on tracking police responses to the COVID pandemic, figuring out how to resist the rise of authoritarianism. And I'm currently spending time in isolation with my family just outside of Toronto in the country.
My name is Zoe Dodd, and I've been focused for almost 2 decades in the city of Toronto on issues related to drug use, homelessness, poverty, Hep C, HIV. And I'm currently working on the front lines addressing COVID and the overdose crisis. So I've been a frontline harm reduction worker for 17 years in the downtown east of Toronto. I also just completed in December my master's in environmental studies with a focus on people who've been mandated to drug treatment, looking at the experiences of people who, like specifically at the programs they were mandated to. And my day-to-day right now just looks like trying to force the government and other officials to have a proper response to COVID in the homeless shelters. So I work with a large homeless population in my daily work. And so far there has been no implementation of a proper response to address COVID. So I've been spending a lot of time kind of gone rogue at my work and just, working on this full stop, and been really trying to get hotels, people moved into hotels and out of the overcrowded shelter system.
Okay, and I'd love to dig more into sort of what's going on the ground in Toronto a little bit later, but maybe just to sort of set up the context and backdrop to this interview, I guess I was excited to have you both on the show when I was doing some background research and came across this project that you both worked on called An Anarchist Response to Hep C and HIV. Can you speak a little bit about sort of what initiated that project and some things that you learned from that?
Me and Zoe have been friends for over 20 years. And I, as someone living with HIV and someone who worked in the front lines of the response to HIV, working in community-based organizations in Canada. We had been friends for a long time, and Zoe was working in Hep C, but we hadn't seen each other in many years, and we kind of encountered each other in our activist and professional lives, Zoe being a leading activist on Hep C work, and me working on HIV stuff, speaking out about rights abuses against people living with HIV. And both of us were really frustrated by the lack of any kind of imagination or activist response. And we were both in Vienna at the International AIDS Conference. The Minister of Health was there, and the theme of the conference was harm reduction. And this was during the Harper years, and our government was vehemently against harm reduction, undermining harm reduction's responses. And we were in a room with all of the Canadian actors in the AIDS response who all clapped for the Minister of Health at this reception, and we were horrified. So we yelled at her. We booed her. And then the next day we mobilized with ACT UP Paris and a couple of other activists, and we essentially stormed and destroyed the Canada booth at the conference to let people know that the Canadian response to HIV was a sham and was a PR project. And out of that came this project where we were like, we need to have more of an imagination. We need to think beyond just the limits and scope of how the Canadian response to HIV and Hep C is organized, which is just through public health approaches and through non-governmental organizations. And there was no imagination to think beyond that. So we started chatting and collaborating, and we came up with this project looking at kind of anarchist theories, integrating into how to respond.
And I think part of it too is like, both HIV and Hep C have relied on the pharmaceutical companies for people's survival. And at that time, and like in the last years, there's been cures for Hep C that, went from, giving someone treatment for like a year of an injection and medication every day from 6 months to a year that caused like debilitating side effects, to drugs that were manufactured that could cure people in weeks with limited side effects. And yet access to those drugs was like almost impossible because they cost about $65,000 for a course of treatment. Yet in other countries of the world, there were people who were getting access to medications through generics. So those generics were like $2,000 or $800, and their governments had set up programs using generics. And so, and these aren't new drugs. So Gilead, they're not new in the way that they've been around before and just reused in this particular way. So, I think also those discussions, like when we were talking about the HIV Hep C anarchist response, was really around the time that Gilead was promoting their new medications for Hep C, and it was becoming abundantly clear that people weren't going to get access to these, and buyers clubs had just started up again, similar to what happened during the AIDS crisis where people were creating buyers clubs. This was happening around the world, and people were telling each other how you could get medications, either having to fly to India and bring them back, or you could get them sent in the mail. And so I think those also, like that was sort of at that time, which really like fed into our conversations a lot about like what would it look like without the pharmaceutical industry? What would it look like if medication was a common good?
Yeah, and I think one of the other things it was exactly the same time as that. So there was this cure for Hep C effectively, but the patent process was making it impossible to get access to. And one of the things also that was happening was, as someone living with HIV, in Canada is a leading country in the world for criminalizing people living with HIV under certain circumstances. And so a lot of activism around HIV or responses to HIV are addressing these oppressive systems, these oppressive laws or oppressive systems that are imposed by the state. And we're always in a reactive position responding to oppression from the state. And so what part of this project was imagining a response where we didn't have to be in a reactive position to state forms of oppression, either legislated or bureaucratic barriers, or all these different barriers which are imposed by bureaucracy or homogenization of the state, or through laws or patents. So it was kind of like we wanted to have like a hopeful project to help expand imaginations, because I think we had always been in kind of a reactive putting out fires moment. So we wanted to take this time with this project to kind of think beyond.
Totally. And I think, within maybe we can call it the Canadian left, there is a lot of critique of the private healthcare system in the United States and a certain smugness or level of assumption about the Canadian healthcare system as being a benevolent, socialized system. So maybe both of you could just comment a little bit about what some of the problems are with the Canadian healthcare system and how it's structured, and what the Canadian response to HIV and Hep C has been that you're critical of.
I mean, I guess I can start with Hep C. So, I mean, I think like people do have a real smugness about the Canadian healthcare system, and they talk about it being universal, but it's not. There is no universal access to healthcare, and it depends where you live. It depends on where your access, what is located in your community, whether you have a hospital, whether you have a nursing clinic, whether a doctor even comes to visit your community. And then in Hep C, what historically, even though majority of people getting new infections of hepatitis C was related to injection drug use, specialists and those creating guidelines for hepatitis C had actively excluded people who use drugs. Now, if you were going to look from a population health approach, you would want to treat those people who would possibly transmit it to then eliminate hepatitis C, but this was not the goal. And so for many years, guidelines were written that excluded people from accessing the treatment because of the cost. So it's like a very sort of eugenics approach to who is worthy of healthcare and who is not, who is worthy to live and who is worthy to die. And so, I think that happens a lot in healthcare. Like I had a friend who was dying of liver failure. She needed a new liver, and she was told, okay, well, you have to be sober. So she got sober. She went for a test, like a colonoscopy, and was given a Valium. She was then on a liver transplant list, but then when in her urine screen, this Valium came up, and she said, that Valium is not, I didn't take a Valium. I didn't take a Valium. And one doctor put a stamp on her form and sealed her death, actually, because then months later she died. She was taken off the transplant list just like that. And so I think when people talk about this universal system, it's not universal for everybody. And Hep C was a really good example of I was working with all these people who couldn't get access to it. I spent the majority of my early career in my work fighting for access for people where there was never any evidence to demonstrate that they couldn't do treatment. It was all based on morality.
I think it's interesting because there's also just a lack of memory or historical memory. And there's this assumption of the benevolence of the Canadian healthcare system and the Canadian state. But in Ontario, the reason we have what's known as catastrophic drug coverage, which covers people who have extremely expensive cancer medications, all different kinds of medications, which end up being disproportionately expensive for people's health, which is what people living with HIV use because our medication costs so much. The reason we have that in place is because AIDS activists handcuffed themselves to the provincial legislature. They dropped banners and interrupted the provincial legislature over and over again. They got arrested, and they fought for it in the 80s. And that's the reason we have the Trillium drug program. So it's not like the Canadian nation state is just happily doling out healthcare. All of the things we have that are not even sufficient now are because of the hard fought wins of people in the community who have been at threat, whose lives have been at threat. And I think that's something that the Canadian left often just forgets. And again, it's similar with Hep C. The idea of universal health coverage is completely a myth. We've often been in opposition to, or have had to position ourselves in opposition to the healthcare system in order to get what we need, through fighting and advocating and working to change the system. Because previously it had not been and still isn't, but has not been there to support our health. One of the things we wrote about in the Anarchist Response to Hep C and HIV was how people living with HIV in relation to their healthcare are seen as not people who are deserving of a supportive healthcare environment to realize their own health and autonomy, but they're understood as an instrument to in the response to HIV. So they are only put on treatment so that they can prevent onward infection, onward transmissions to other people. And it's a very top-down system that views people as objects within and objects and instruments, not as people with autonomy.
And it's interesting the action that happened, like when they disrupted the legislature so people get access to medication. I mean, we copied that in the Toronto Overdose Prevention Society, which I'm a co-organizer in. Last year, we dropped banners inside the legislature, which isn't like the easiest thing to do because they make you check everything and you go through 2 searches to get inside the legislature, but it's not obviously impossible. But we also did that to disrupt during because the government had decided that they were, that they decided not to fund 2 overdose prevention sites in the province, which we had fought for. We were fighting for a response to the overdose crisis. And so we went to Queen's Park to remind them, like, we are going to continue to fight. Those sites are still open today, and we will continue that fight.
That's super cool to hear about that sort of lineage of struggle and that sense of continuity over the decades.
Yeah, I think like a lot of us, I think it's important to look historically. I think that people did things which you can also like organize around. Like it's important to know your history, talk to people who've been there before. I feel really privileged that I know a lot of the older AIDS activists from that time. And then there's also like this momentum of other people with new ideas and who also have the political courage to like disrupt, to agitate, to speak out, which isn't always easy. A lot of the people I organize with are women, and a lot of people I organize with are people who actively use drugs. And so, it's like we've learned a lot, and I think people will in history learn a lot from the organizing that we have done too, and that's important. And we also spend a lot of time mentoring each other and teaching people how to do things and think differently, and to like sort of liberate ourselves from like the ways in which we've thought things could be done, and open our imaginations to how things could be done and to actualize them.
Could we, and I also want to just ask a question about this point that I think you made, Alex, in terms of Canada being at the forefront of criminalization of HIV. Can you explain what you mean by that?
Yeah, sure. So since the late 80s, Canada started ramping up the criminalization of HIV. So I guess that means that when HIV came about, which is really interesting that this is happening with COVID right now. So that's one of the reasons why I've been engaged in kind of reactions to policing of COVID. But when the HIV panic was really at its height in the late 80s, there started to be these complaints against different people who had HIV, like sex workers who were still working but apparently had HIV that people were scared of, or someone slept with someone else and they didn't know that person had HIV. So people started complaining to the police about it, or to public health authorities. And then there started to be some criminal cases, and they popped up pretty quickly. And then over the years, Canada became known as one of the leading countries for criminalizing HIV. And the way it happens now, because there's been a number of Supreme Court cases, the primary charge that's applied is aggravated sexual assault. And it's in the context of when someone living with HIV is alleged to not tell a sex partner that they have HIV and not take certain precautions. So they might, they have to use a condom and have a low viral load at the same time, which means they're on medication, in order to be free of the legal obligation to disclose. And so there's many problems with that. That was based on a Supreme Court decision in 2012. And I think since 1989, we've seen around 200 cases. Often the cases target already socially marginalized people. They disproportionately target Black men who aren't originally from Canada, who are newcomers, and also Indigenous people and women with histories of street-based sex work, and queer men. And so I did my PhD dissertation interviewing people who'd been criminally charged in relation to this, because I've had a number of friends who've experienced either being arrested or had been called to be part of one of the trials. And it's something that I think every person living with HIV in Canada, there's 65,000 of us, has had fear related to criminalization. And I think I've been someone who's been living with HIV since I was a teenager, so I've never known my adult life outside of living with HIV. And for me, HIV now is not the problem. The problem is the criminal justice system and the police. The thing to be scared of, or any harm that will come to my body as a result of having HIV, has nothing to do with the virus itself. It only has to do with the violence that could happen as a result of engaging with the criminal justice system and police because of Canada's punitive response to dealing with this issue. And so I interviewed people across Canada, and I think one of the very common assumptions that we see in the media about people living with HIV is that in these cases they're actively out there trying to infect other people. And when you talk to people face to face, you realize that it's completely a fallacy and completely a myth, and it's nothing further from the truth. Often people I talked to tried in different ways to disclose their status, or actually did disclose their status to people, or there was actually no risk of infection. And the thing that's fascinating and up about a lot of these cases is that it has nothing to do with transmission. It only has to do with this mechanism in the law, which cancels out someone's consent under conditions of fraud. So alleged non-disclosure, someone not telling someone else that they have HIV, cancels out the other person's consent to sex, which constitutes a sexual assault. And adding HIV in the mix makes it an aggravated sexual assault. Aggravated sexual assault is one of the highest charges in the criminal code, which is reserved for the most heinous, actual non-consensual sex acts, which involve a weapon like a gun or a knife. But in the case of HIV non-disclosure, it's applied to instances where there was no violence, no risk to harm. And so it's a massive violation of rights and also completely counter to science. But it's how the criminal justice system works. So that's the criminalization of HIV.
Yeah, and my understanding is also that if someone is subject to those charges, they end up on a sex offender registry, which follows them for the rest of their lives. And also, if they are sent to prison with charges like that, it could be an extremely dangerous situation for them.
Yeah, I mean, anyone who's charged or anyone who ends up in a Canadian prison is extremely vulnerable to violence. But when adding HIV into the mix and the dirty charge of aggravated sexual assault, people come to be understood as like way riskier and more of a threat. So the people I spoke to faced really intense forms of violence when they were incarcerated, from guards and other prisoners. Also, a lot of violence at the hands of police, aggravated sexual assault. There's a mandatory requirement to be registered as a sex offender, which means the government takes your blood against your consent, and you're on a record for life, which means everywhere you live, every year you have to check in with the police station, and you're strip searched and photographed and interviewed, and they know where you live, and you're on a registry. So anything else that happens to you kind of also will trump up any charges. It's a very harsh situation, the way that Canada is dealing with it. And there's been a lot of advocacy to change that, a lot of dedicated activists working to actively change that. And we've had some successes, but it's still very much in flux, and there still are charges happening.
So, of course, Hep C and HIV and COVID are all different, things with different contexts and situations. But what are some of the lessons in your participation and research in anti-criminalization stuff around Hep C and HIV? Do you think you can take into the current situation with COVID-19?
It's really depressing right now because, all these laws are changing, or they're introducing bylaws to target people around COVID and like or physical distancing. And really, these are just like very classist distinctions of like who can stay home and who can't stay home, who can physically distance themselves. Like I take transit to work, and when I look around who's on transit, you see homeless people, you see a lot of Black and brown people going to jobs that have been deemed essential. And you see a real class distinction of like who is responding. And then when I like get to work, I see a lot of homeless people on the street, and I just like worry about the targeting from police. I spoke to someone, my coworker was taking prison calls yesterday, and a man that we both support is in prison right now, and they have like a native range at the Toronto South. And, they still have everyone bunked together, and they have cells that are empty on that range. And we were both talking about how, what are the plans for further criminalization and targeting of people on the streets? And yet people have nowhere to go. Everything closed down around them. There are like 59 drop-ins in the city, and only 10 of them are slightly functioning. The shelters are overcrowded. People's like spaces that they would go and hang out have closed down around them. So there's a lot of people like outside on the streets, and they can't physically distance. And then who gets to determine who your family is? So they're saying you can be out no less than a group of 5 people. And yet who determines who your family is and who your network is? And also rules around like finding you if you don't say your name, if you don't actually give your real name, putting people in jail for such things. And so my fear is the use of the state to further criminalize and marginalize people who already are so criminalized and more marginalized, and people are already being harassed by the police regularly to move along and to not be outside. And police have been asking people like, why are you outside? You're supposed to be inside for 14 days. Well, they don't have a home to go to. So I don't know how they can be not outside. And like our demands have been around decriminalization, legalization, though I struggle with legalization under a capitalist system. And could that be more criminalizing? But, we have people who are outside who are going to procure drugs. We have drug sellers outside who are providing the service of drugs to people. And like how these rules about like, these increased measures, how these will impact people, how they will further criminalize people, and how they will make them more vulnerable to criminalization are things my colleagues and I are continuously talking about, because we're deeply concerned about how this will impact the overdose crisis, which on March 31st, we had the highest number of calls to EMS in the city that we've had in years. And we also have, and that's just EMS. I mean, we have overdose prevention and safe injection sites in the city who also respond, and then the community itself responds. And people have like put up naloxone kits in the park, like hanging from trees. Like this is such a desperate situation that we're in. And so I worry, like, how will further criminalization of communities like drive the overdose crisis? How will it impact rates of HIV and Hep C, and how will it impact people's lives? Like, will they survive? And I think a lot of us are preparing that a lot of folks that we know will not survive in the next during COVID, and not because of COVID alone.
It's interesting because in the beginning, when back in the early 90s, late 80s and early 90s, when Canada started, or when there started to be the criminalization of HIV and these very early cases, there was lots of debate around the use of the criminal law, around whether there are some people who are more morally blameworthy, they're being reckless, or they're considered more of a threat. And at that time, there was like some AIDS activists who were actually pro-criminalization. But there was also this distinction that was made with what that happened at that time, being like, well, actually HIV is a public health issue. And so as activists, except for these like really blameworthy cases where someone's done something really heinous, which I don't agree with. I don't think there should be no criminalization for anyone. But that that HIV should be dealt with as a public health issue. And there's this distinction that's made, which is really interesting for me, because they're both, I see them both an extension of the same thing. If you look back to the beginning of Canada intervening in infectious diseases, like at the end of World War I, when there was no public health infrastructure and public health was just being conceived of as an idea, it was deeply rooted in eugenics. And the infrastructure they used was jails and the criminal justice system. They would detain people with various forms of STIs, gonorrhea, syphilis, herpes, in jail because there was no public health infrastructure if people tested positive. And so since the beginning of the Canadian nation state, public health and the criminal justice system have been intertwined, and they still are. And so that's really troubling or complicated in terms of right now when the authoritarianism of public health is being so firmly entrenched. And one of the things that one of my mentors, Gary Kinsman, who is a queer activist and scholar who was part of AIDS Action Now and has done lots of stuff on Canada criminalizing queer desire, but that he always says is, when we look at public health, we have to think of who are they talking about as the public in public health. And people living with HIV are not the public in public health. We are the people that the public should be protected from. And that goes the same with all of the people that Zoe's working with. Homeless people and people of color and drug users and people with Hep C, they are not the public in public health. They are the people who will have exerted on them the most coercive, harsh, punitive, and surveilling approaches from public health. And it's interesting now because everyone is kind of under this authoritarian regime of public health, which most risky people are often under all the time. But it's very fascinating or difficult, I guess, to view the entrenchment of public health authoritarianism when public health itself is also a threat and also problematic and entrenched in colonization and racism and eugenics and criminalization.
And I was thinking too, how they're a bunch of fucking hypocrites, like they want to fine people for like going outside. If they're positive for COVID, they're going to fine you. You could, I don't know what all the penalties are, but those penalties will increase. And yet we have overcrowded shelters with hundreds of people staying in them, where public health has not directed those shelters and the staff and the people who operate those shelters to implement what needs to happen. So we still have people sleeping a foot apart from each other. We still don't have hand washing stations in them. There's no screening at the door. Some staff in some places are told, do not wear a mask. We don't want you to scare people that are staying here. And yet those conditions are so overcrowded that they are and there's people who have come back positive, workers and service users of the homeless shelters, and yet nothing has been implemented to stop the spread of it. And yet here we are hearing these other messages, like if you go outside of your house, you will, well, who the f*** is in charge of like making sure that, this doesn't spread? But it really just shows the class distinction of who we care about, who we don't care about. And we're not going to like move forward in quarantining COVID but if we don't actually address it amongst homeless people, get people out of the shelters, open up hotels where we're not going to be having tourism in the next year. So like open up hotels, get people so they can physically isolate, give them a fighting chance, but also no one cares about us as workers. Those people making decisions, they don't care at this point if we live or die, but they also need us, because as soon as we start dropping as like flies, that whole infrastructure of like trying to support people, the thousands, almost 8,000 people who stay in shelters in Toronto, once folks stop showing up to work or saying that it's too unsafe for them to work, those systems will fall apart. And they're relying on workers, a lot of temp workers who do not make any money, who have to go to their jobs because they're not going to get the benefit from the government, and they need to like be able to survive. So we have like, it's just like so infuriating because there's distinctions. And I think there's people I hear people calling for more lockdown. And I'm like, yeah, that must be so nice from the safety of your fucking home. While other people who are going to be targeted by this are the people on the streets. And if you are so concerned, stay in your house and shut up. But everybody else is like, there are issues with people people need to be supported. And I'm sorry, I feel like very overwhelmed by it, because I've been just like bearing witness to all of what's going on the ground. And it was like this during the overdose crisis too. We couldn't get properly resourced. We couldn't get the government to care. We had a task force at one point that had a whole group of us working together. They disbanded that when politics changed and the government changed. And that is not the way we should be taking care of people. It is not the way we should be addressing health concerns. But this is the system that we live in. This is what it's like to live under a capitalist system where bodies are completely disposable and no one gives a fuck if you live or die. But with COVID, they should care, because it's going to impact them and how long we stay isolated in our own homes.
And this is the thing with the criminalization of COVID that's ramping up, or like the punitive public health measures. It's like there's a massive fine and jail time. And people who aren't going to be able to pay the fines will maybe get also a court order that could lead to jail time if they don't get jail time. But we're going to put people in fucking jail to deal with a communicable disease, which is like already, like, I just can't even, it's shocking to me that that's considered a public health response. And that's where you see that how deeply intertwined public health and the criminal justice system are together. The last resort of the public health apparatus in Canada is to put people in jail.
Zoe, I'm wondering, as a frontline health worker, the government is really framing this whole situation as some kind of war effort. They're really appealing to that kind of narrative, and encouraging people to, do things like clap on their balconies for healthcare workers and doctors and public health officials, while at the same time you're saying that you're not getting the resources you need to protect yourself on the ground. So, what is the disconnect there, and sort of what is the relationship that you feel with public health authorities as somebody who's like on the ground working on this?
Yeah, I would say there are workers working in drop-ins and shelters without even masks or hand sanitizer. They've been given no guidance on screening. So there's like no screening happening. And so, we're being told, okay, you guys stay 6 feet away from somebody, but there's no way to do that in a shelter or in a drop-in situation. And then we've got people handing out meals to people on the street, but then everyone's crowded to get those meals. And now people are actually calling and reporting to public health about the lineups outside of meal programs. And it's like, oh my God, like we can't win here. So there's a PPE shortage because, we didn't learn anything from the other pandemics, which is like, make sure everyone in your workplace who's working in healthcare is mask fit tested. Everyone should have known what masks fits their faces. That should have already happened. And so there was a lot of scrambling to get people mask fit tested. I do not think that shelter workers or drop-in workers have been mask fit tested. People do not see them as healthcare workers, and yet in a pandemic, they certainly are. There are also people so at risk of spreading it and also getting it. And so we do need to care about them. So they weren't seen as a priority. And same with like supervised injection services and overdose prevention sites. I mean, what we do when we intervene in overdoses is we use high flow oxygen. And so we could aerosolize the virus. And so we quickly we're like, okay, we got to get protocols in place. But the cities public health run, the largest supervised injection site in the city has now been closed for 3 weeks. So at first it was to deal with the protocols, and then we found out that their workers got sick. So public health, this instrument that's supposed to be in charge, have workers that are sick and have closed down the largest injection site because they got COVID, because they were all at the same meeting. And it just speaks to how it is not organized. It is not like what they're trying to implement is just trying to play catch up. And also we cannot rely on a capitalist system when we are look at the manufacturing of PPE. We can't get PPE. So what they're telling us is oh, you don't need to wear a mask. Actually, you do need to wear a mask. If you are very close to people, you should be wearing a surgical mask. Yes, you should. And actually, if we had PPE, we'd all be in N95 masks. That is the truth of it. We would not be not wearing surgical masks. You would have everything that you need. At our workplaces for the overdose prevention sites and supervised injection services, everybody's in full PPE. Because we don't know. This virus is so contagious. So I think lives, like workers' lives, are being put at risk, and those people staying in these conditions are being put at risk. And people don't see these frontline workers as health workers, but they are. And they're going to be some of the first to assess people, help them get to assessment centers, which is also a problem. Like, it's really hard to convince people who've been treated so miserably by the healthcare system to go to an assessment center. And then people who've been incarcerated, people who've like faced the brunt of criminalization and colonization, trying to explain to them, hey, yeah, like we need you to go to an assessment center. And then you're going to get whisked off to an isolation center, and then we don't know. And you won't have contact with people because no one can visit you. I mean, the way that things are being set up is not being set up for the folks that are going to be we should, like in long-term care facilities, you hear a lot of talk about that. There are a lot of seniors in shelters, and there are a lot of people whose bodies are like a 40-year-old whose body is like a 60-year-old. It's been so beyond frustrating. I think almost every day I weep. I've been crying as I've been going to my job because it feels really heavy. Just knowing that all these workers and all these people, that no one cares about them, that those ruling regimes are making decisions that are going to wipe these people out because they don't care enough. And I wish that workers could see themselves as having power, because their refusal to go to work is so powerful. Their refusal if they organize themselves, like some have been sending out like photos of what's happening in the shelter system. But if more of them did that collectively, they would get what they need. We'd get people out of the shelter system. They would get PPE. A private funder has had to step in and is offering personal protective equipment. He's put in $200,000 to get personal protective equipment for everyone who's working in drop-ins in shelters, and that happened yesterday. But that should have been the role of the state. And a lot of workers are really scared. Like a lot of my friends, we've been working together so long. Like a lot of us were already really traumatized by the overdose crisis. Like I've witnessed and responded to hundreds of ODs now, and we've lost so many people, like colleagues and people we work with. And so we're already like incredibly traumatized. And then we're seen as essential workers, and the government has now listed us as so. And a lot of workers, they don't have anything else but like to work these jobs because they don't have any other access to money, and they probably wouldn't get the benefits from the government. So they're going to work scared, like terrified that they could die. And that's because, and that is a terrifying feeling, to think like you may not be here, because healthy people have also died of COVID, and a lot of healthcare workers.
Is there a culture of mutual support within that community of workers in terms of looking out for one another, developing kinds of ethical practices to just have each other's back through this period if you're feeling sort of left out by government measures?
Yeah, I think like there was a real bond that was formed between a lot of workers when in 2017, because of the state neglect in terms of responding to the overdose crisis, a group of us went into Moss Park and set up an illegal injection site, and we ran that for a year, and we helped change like the response to overdose in the province of Ontario, and I would say across the country. And from that, there were 150 people that volunteered with that site, and it created like these really strong bonds between us, and like really is deeply, like mutual aid is deeply entrenched into what we do and what we've been doing. So yeah, workers have been, we take care of each other. We also have planned each other's funerals, and we've held more memorials for people that we've lost, like other workers, right? So we've taken on so much in terms of like looking out for each other, and that also includes giving each other money, going to score drugs for people so that they can go to work and be at work, because a lot of people who actively use drugs work in harm reduction. It also is like, calling people to make sure they're okay, helping each other detox, supporting each other, because we never got those supports. And so now there's lots of, like, it's interesting. There's been a lot of like therapists offering services for COVID, and that's cool. But like, why did they never do that for us in the overdose crisis? Like, that's still raging on, and everybody knows how much we've been harmed by the lack of support. So it's cool to see people stepping up and offering mutual aid during COVID. And then it's also glaringly hard on people when everyone's like, well, where have you been? Where were you these last 5 years? Well, we've publicly talked about how much loss we've suffered and how much trauma we experience. So I don't know. But yes, we do look out for each other, because who's going to look out for us? And then obviously, like, our friends in our lives also are good to have around, because they also know what we're going through, but they worry about us, right? Like, I think we're all really worried about each other right now, for sure.
Do either of you have examples of resistance to criminalization that has been inspiring to you, either in the past or in the present moment?
Well, I looked, when I was doing my work, I looked back at different responses to criminalization of HIV in Canada, which I found a bunch of instances about. There was a lot of resistance initially to the publishing of people's names and photographs, which is now a common practice that is a kind of violation of people's autonomy, and where if there's a charge in relation to HIV, a criminal charge of alleged non-disclosure, the police will put someone's photograph and name out right away. And often that's not contested by anyone. It's just considered a legitimate policing practice. But in the early days when those cases first came out, AIDS activists would stage demonstrations against newspaper outlets that republished police information, challenging that practice. But I think one of the main ways that in terms of HIV criminalization that we've been able to kind of shift slowly things is through having people who have had firsthand experience of being criminalized talk about the violence that they've experienced as a result of criminalization. And that's violence from the state, violence at the hands of police officers, violence at the hands of the criminal justice system and courts, and kind of highlight that and what that means for people and how people's lives are completely ruined through this. But similarly, it's been a challenge because people who are targeted by the criminalization of HIV are already socially marginalized people who aren't cared about by anyone in the state either. There are poor people, people of color, people who have histories of street-based sex work. And so it's been a challenge. But I think hearing people's experiences is one of the most powerful things that's helped to lead to some change.
Before, when supervised consumption services, I used to like not be into them at all, because I was like, oh man, this is just going to increase surveillance of people who use drugs. And also it's like medicalizing drug use, which is actually like more of a social and cultural practice than it is a medical, like you don't need a medical intervention is how I felt about supervised consumption services. But, you know, I've been a big proponent of them because we needed them in the overdose crisis. I mean, I think if the drugs weren't so toxic, people should be able to use at home. They have homes. So, I mean, I see, you know, I am inspired by the ways in which people in the current context have really stepped up to have discussions about criminalization of people who use drugs and have figured out ways to use the system to sort of decriminalize use. So from having supervised consumption services, which many of us talk about being demilitarized spaces and decriminalized, to people having buyers clubs and selling heroin to each other, buying in bulk and then selling heroin to each other, and to avoiding criminalization by like limiting people having to go to other sellers. And like, I don't know, I love that. It's really inspiring. And then also doctors that I know who have stepped up and are started prescribing people what we call safe supply, which is also a form of legalization and decriminalization and resisting criminalization of people. And like by providing people with opiates, prescribed opiates, you're really limiting people's interactions with having to like score on the street or having to hustle to get money to get drugs. So I'm inspired by the everyday practices that people are implementing, and then sort of the creative ways that people are talking about how to sort of work around further surveillance or like the police state targeting them when they're out on the streets during COVID. There's some really interesting suggestions that people have that I find like super inspiring that people are sharing with each other, from like, telling, suggesting to people like, carry a grocery bag with you, look like you're going grocery shopping, tell them that's what you're doing when you're going to sell drugs. And like some of us have been talking to sellers about how they can stay safer and what they can do to limit their exposure and transmission of COVID. So, I'm inspired by those actions. And I mean, there's lots going on around the world and there's lots historically. I just, sometimes we forget to recognize what's happening in the everyday.
And I think, yeah, similar to like resisting practices of surveillance or resisting state surveillance, there's been a long history of that in the AIDS response. So one of the things that AIDS activists in the early days fought for was anonymous HIV testing, so that people could test for HIV without having the state have a record of that. And now, essentially, that doesn't exist. And so people have been taking into their own hands kind of ways to keep themselves off the public health record. And there's different strategies that people take. And a bunch of us made this zine a few years ago called How to Have Sex in a Police State, which documents some of those different ways that you can like resist public health having your name, and avoid being on the public health record, which is connected to the history of AIDS activism.
Yeah, and I think one of the most troubling things that I'm seeing is just with social media and technology, that there's this, I think you called it in a recent article, the crowdsourcing of policing that's happening. So even on these ostensibly well-intentioned caremongering groups and stuff like that where people are like posting photos of groups of 6 in a park and making assumptions about their relations with one another, and in some cases calling the police. Do you think there's any hope of fostering a culture of non-cooperation with the police or non-criminalization within these spaces? Or do you think we best focus our energies on specific communities that are already criminalized?
Well, it's really hard in the context of so much panic and fear and the ramp up of snitch lines. Like, I feel like every municipality has a snitch line now, and the reporting of the snitch lines has shown that they're like being extremely popular and actively used, which is really disturbing. I mean, we've seen this before in the AIDS response. People call public health on other people all the time. People call public health on people living with HIV all the time, and we've seen the outcome of that is like really harsh and coercive measures against people. My friend, a couple of years ago, a woman living with HIV gave birth and was completely virally undetectable. Someone called public health on her. There was a whole public investigation about her because she was breastfeeding her children, and they threatened to take her children away. There's no risk of transmission, but the public health are coercive and punitive and are not the friends of many people. I mean, right now we do need them, and we need to follow certain public health protocols, but the reaction to create a context of fear and suspicion and snitching on each other is the complete opposite of what is needed to respond to a pandemic. We need a context of community support and care and compassion. But right now it's just suspicion, reporting, and like report. I posted this article I wrote on my Facebook wall, and I got all these messages from people being like, "Fuck you, you're trying to promote transmission. We need to report everyone, report." And people are scared. And when people are scared, they go to their most base gross level of being discriminatory and relying on oppressive authority, which is disappointing. But at the same time, when people are scared, they also go to mutual aid and these most beautiful ways of supporting each other. So I don't know. I'm overwhelmed by the whole thing.
I think the government too, because they're not admitting, like, I think people don't understand. Well, one, okay, media aren't reporting properly on what's really occurring. Two, there's like not a lot of transparency. So, there was like wanting to hide the numbers of what it's going to look like or how long we're going to be isolated. I mean, not having transparency also breeds fear. And I think, like for me, I personally like to know everything. Like, just tell me the truth, That's where I would like to work from. But for other people, knowing the truth, I think, makes them afraid even more. But also the way that this has been framed as an individual response, like you do your part, you stay home, you isolate. I think also people are hopefully will see the cracks, that the government doesn't have the resources, that decades of austerity have impacted their ability to respond, that the reason we don't have people moving into hotel rooms is because the hotel industry isn't interested in opening up their doors, or maybe we don't have the staffing for those hotels, but they don't want to admit that.
Yeah, and the response to the pandemic has been framed around following rules, listening to authority and following rules, and disobeying rules is framed as undermining the response. And it's individualizing the response, and it's creating an idea that there are certain people or certain disobedient people are infectious and dangerous and vectors of disease. And when we see that similar logic applied to HIV, we know it's completely wrong and completely the wrong approach, because it ends up targeting marginalized people. It reinforces different forms of social marginalization that already existed and creates new forms of stigma. And so, yeah, individualizing it takes away any form of state accountability or any accountability at all, and puts it all in the hands of so-and-so wasn't following the rules, call the cops on them.
Which is the same as like what's going to happen in the shelter system, where these doctors have decided that they've devised this like really, they're calling it risk stratification. So their goal, even though they've had weeks to implement this and nothing's happened, but their goal is to like look in the shelter system for homeless people who would be the highest risk of having complications due to COVID. And so then they would put a bracelet on that person. And then they've made these posters, and hopefully they'll ditch this because it's just so horrible, where the posters say like, join the movement, get a bracelet. And we've been trying to explain to them, like wearing a bracelet could also be like seen as like, it could increase violence against people. People could be seen as the vectors of transmission. People could like really misinterpret what the goal of these things are. And also, why leave someone still in the shelter system wearing a bracelet? So, and we've tried to explain to them, anything that marks a person, which throughout history has been used to further marginalize and oppress people and kill them, has significance. And this is like a terrible idea. And so trying to explain this to these doctors has been really challenging, because their egos are so in the way, instead of listening to the real concerns coming from people who have a lot of experience with working with folks, and also just like history. You don't have to it's not that hard. It's not rocket science here. It's like quite simple. And then again, it's like blaming the individual or focusing on an individual instead of seeing the context of people as a whole, or people in like shared common space. And so we've been trying to give tents to people. We've been collecting tents and handing out tents to people and saying to them, like, if you don't want to be in the shelter, here's a tent, here's a sleeping bag, get out. I think sometimes anarchists and radicals like only see themselves in sort of a bubble. They're trying to speak for everyone, but they oftentimes neglect to talk about other communities. So I would just say like that's an important practice, is to expand people's worldview to like include other communities beyond ourselves. It's very easy to like practice mutual aid amongst a group of friends, but how are we practicing mutual aid to people we don't know? And I know there are people who are doing that, like who have been asking for different ways that they could do that, from other workers showing up to other workplaces and delivering food to support the workers on the front lines, which I think is such a beautiful gesture, to sewing masks for people in the community so that we can hand them out to folks in the community.
One of the things to, I think, remember, or in terms of tracking the specific reactions, police reactions, so far the people who have been charged are people who've been charged in the context of them are committing other crimes. So we've seen a drug dealer charged with operating a non-essential business while dealing drugs.
And it is an essential business, drug dealing.
Yeah, but he was a street-based drug seller, drug service provider, as Zoe likes to say. And we've seen a guy in Ottawa who was arrested by police for assault because he was stealing a bicycle, and he spat at cops and said he had COVID as a way to get them away from him. It doesn't have COVID, as far as I know. And in Saskatchewan, there was a group of people who stole an SUV, and the COVID law was used, or the COVID law, there was 11 people in this SUV, must have been a big one. But the more than 5 people gathering restriction was used against them. And so these laws are already targeting people who are marginalized and are doing other sorts of issues that they're being criminalized for or targeted for.
And I think like one thing like people could be doing, and this is what we've been sort of, organizing on the street level. We've been trying to get people who are at home or who have who are at home to get engaged with helping us with whatever actions we do. We did a phone zap to the mayor's office yesterday, just trying to get people to help us. Like this is a time to really, like, the people could show some power and we really could use more people helping us fight for some basic survivals.
Can you maybe plug some of those places where people can find, I know that the situation's changing day to day, but if somebody's listening to this a week from now, where's a good place to kind of get up to speed on some good campaigns that are happening or projects that they could plug into?
I mean, I think things are going to like heat up if things don't come into place soon. And so I think people could follow people online. I mean, I have a Twitter. It's at Zoe Dodd, ZOEDODD. There's also Cathy Crowe, who's a street nurse who's been talking a lot about homeless people. I think it's good if people follow her. I think there's different people know who to follow. And I think that there's the Health Providers Against Poverty and the Ontario Coalition Against Poverty, and there's the Toronto Overdose Prevention Society. There's just many groups. And then there's many groups in their communities that have been organizing around these issues. And there's people who are organizing rent strikes, and like in Toronto, it's Parkdale Organize. So, it's good to tap in and like ask people, hey, what do you need? What could I help with? Because I have this skill and I'm at home. And, that could be like designing graphics to like organizing people to be part of phone zaps or sending emails and phone calls to public officials. Like, I know it's hard because on one hand, we're just like, I hate authority. I hate the state. But at the same time, like, we do need to put pressure on them to get what we need right now, because we're not in a system that can afford us anything else. So, I mean, I also would say that people need to spend this time, and it's really hard in a crisis, and I have to remind myself to do this, to dream of what you really want to live in. Think about that further than what we're in now. Like when I see people talk about, because we have so many drug shortages going on, I try and encourage people to think about what it would be like if pharmaceuticals were a common good. What would it look like if we had control of the development and implementation and distribution of them, and we didn't see them we remove the profit imperative. And when people are having conversations with me, I'm still trying to get people to think beyond, because what COVID has highlighted to many people who hadn't thought about these types of things before and hadn't thought about living in a different way, it's really opening that up to them. And I think that we need to be having conversations with people and constantly educating each other. And I think that's a role people can play. And it's really easy to become defensive and reactionary. And of course, like, there are moments for that, but I think there's also moments for people to spend some real time explaining certain political ideas people had never thought about before.
Yeah, I guess, I mean, there are quite a few people who are organizing to resist policing and the rise of authoritarianism. I think one of the good hashtags to follow is policing the pandemic, in terms of lots of people are posting stuff, resistance to policing. Different people around the world are tracking the different emergency orders and emergency laws that have been enacted, and forms of state oppression. And I think you can find a lot of that stuff through that hashtag.
COVID-19 has exposed the many failings of states around the globe. Millions have lost their jobs, leaving many unable to pay rent and in danger of eviction. In response, tenants around the world organized rent strikes for April 1. As the crisis continues, even more people will fall short of rent. More rent strikes will begin May 1 and maybe even June 1. If you're worried about making rent now or in the future, it's time to get organized. Reach out to your neighbors, find your local tenants union, and let the landlords know you won't be paying rent. Then fly a white sheet from your window to spread the message. Channel Zero Network podcasts have put out several episodes on tenant struggles surrounding COVID-19. Check out Rebel Steps' emergency rent strike episode for ways to get started. It's Going Down's episode This is America, number 111 and 112 for interviews with organizers, and the Final Straws episode Doing for Selves to hear from Tenants United in Chicago, and Crime Thinks, the Ex-Worker podcast, episode 75, for an overview of rent strike tactics and history. Even though we don't know what the future holds, we do know that stronger communities are the way to ensure a better world for all of us. We can build those communities one person at a time, building by building, block by block. Be ready to join the movement on May 1.